The first question is registration. How easy is it? How easy it is to get registered at a GP? And with 3 of us on the first table, we must say that we haven't had any sort of difficulty in registering with our GPs. And we say easy, and we say no personal experience. And some of us have been 30 years, 40 years with our GPs. The next question is getting appointments. Do you get an appointment when needed? We say yes. And if you are a carer or a parent, it says, why is it important to have at a specific time? So if you are a carer or a parent, then you might need a specific time. The third question is seeing a specific doctor. Is it important that you see a specific doctor? And he says here, yes, for continuity of care, so that you don't have to repeat your history. But no, because sometimes you might have benefits of second opinion. Because if sometimes, if the patient knows you too well, then you assume that when you come in, yes, I know what your problem is, but it might not be the same problem.
Okay, reception staff. I will read this one because it's very important. Triage needs knowledge to decide the severity of the diagnosis. Receptionist role in triage, none. Confidentiality, would prefer to give details to my GP. No confidence in sharing my details with reception staff. I think that gives you a flavour of what we were thinking on that one. The usual suspect of difficulty getting through on the phone, as everybody else has said, you could be hanging on for a very long time and not actually get through. Some people said they would prefer to email their GP direct rather than going on the phone. And referral to other providers, not at all. But some said that GPs had good links with pharmacy. Some had joined up services, and GPs linking up with other services, not that well. I think I would like to just say that some people were in the north of the borough and some people were in the south of the borough. The difference between the north and the south can be variable, shall we say. Thank you so much.
Information and signposting. Do you get the information you need on health services to decide where to go when you have a specific condition or concern? The consensus was yes. Most people felt that their GP, their surgeries had information on where to go for different things, except for one case where the surgery is not accessible. We need to make that surgery accessible for people with disability in terms of how it can be improved. The third question was, what services would you like to see move away from GPs? None. We want the GPs to get on with what they are doing, and wherever they need improvement, they can, do that. What services can they take on? None at all. Again, get on with what they are doing. The other question is, doctors can be too quick to reach for medication. What about alternatives? A lot of us felt that, we want our medication, we want our medicines, where necessary, because we believe in them. In terms of alternatives, well, if the doctor feels that we need signposting for, on diet, exercise, talking therapies, fine, we will accept those. Have been given good level of advice and information. Yes, that was unanimous. Yeah, people have been given information, but in some other aspects of their health, they don't quite know, because, what is good, what is not good, they really cannot, decide. In terms of getting the appointment before 8:30, people felt, well, that's questionable, and I think the other groups have mentioned it, because sometimes people spend a long time on the phone, others have to go to work, and it may not help. I think that's about all the bullets that we have on the different sections. Thank you very much.
Thank you, Sylvia.
Information and signposting. The first question was do we have enough information? Do we know where to go for information? And people did not really know where to go for information on the health services in general. But when they did have information, they were quite happy with the level of information they had. People were not sure what services are available. So in fact, there are a whole bunch of services that people, for example, 111, as I said before, there was lack of awareness of what exactly that is, surprisingly. There was one comment that we should not, one reason why there is lack of information is that the NHS service changes a lot, or certainly has been changing a lot over the last couple of years. And that has confused everybody. And presumably it will settle down, but the comment was, let's not change NHS as much as we do. Where can we improve information? The comments were: 1, advertisement; 2, leafleting each house with the basic points. And there are the problems with that. The CCG has tried this, I think. And they had, I think, budgetary issues, if I remember right. Well, you tried it and it didn't work that well. And actually the major point here was that it's in the interest of GPs to disseminate information of all the services that are available, because it takes the load off them and they're under regular pressure. And they should really be the focus of disseminating information on this. So that was that one. And there is one there. Right. Service change. So the question here was, what was the question? I'm sorry.
What services would you like to see move away from GPs?
Right.
Services.
So what services would you like to move away from GPs, and what do you want to add to them? And with regard to moving stuff away from GPs, things like inoculations, which are already done to some extent by pharmacies, so there's an overlap, so you might as well make a clear distinction there. Blood pressure, health checks, these things could easily go away. But there was a counter idea on this, which was that taking blood pressure, for example, checks is very important for GPs. It gives them a lot of information, and if you took that away, how would you have the information sharing? So the idea was that you might have a hub in which you had these different, like pharmacies and GPs in the same hub, and then there would be an easier interchange of information. With regard to adding stuff to GP's current workload, the idea was that no, you don't want to add anything to them. They're already very overloaded.
One of the issues we had was pharmacists referring people back to the GP, where people go to the pharmacy to ask for advice, they're often referred then back to the GP, and once that's happened 2 or 3 times, people are less likely then to go to their GP, their pharmacy as the first port of call. 111, we felt signposted to services, but we had no real recent experience of that. An interesting conversation we had was on the difference between 111 and 999, and there we had, of the 4 of us, one of us felt that 999 was being replaced by 111, which might be worth looking into whether other people have that perception, because obviously you need people to go direct to 999 if it is an emergency, and for people to understand the difference between what constitutes 999 and accessing 111. The second one was information and signposting. We thought most of the signposting was done in conversation with the GP, but that and that there was improved signposting as to which service to access, but it still needs to improve, so people know their first port of call for something is a pharmacy, their GP, or whether they should go direct to A&E or 999 or whatever. That GPs perhaps should be encouraged to give more options. Some people felt when they went to the GP, they weren't sort of given different options for their care, and perhaps that's something that could be improved. Regarding service change, the only thing we could think that moving away from GP services was perhaps pharmacies could deal with some of the prescriptions. You didn't need to go back to your GP, because pharmacists are, very knowledgeable on that sort of thing, as I think the gentleman here was referring to. And the need for all IT systems to sort of be linked up, but then you've got the controversy of people not wanting their data shared. But we felt that that was really very important, that if you presented unconscious or in a road traffic accident or wherever, that the clinicians would have access to the information to say you're allergic to penicillin or you're epileptic or whatever. It's quite important.
Basically, access. We'd all been with a GP a long time, so we never had to go registration or anything like that, and so there was very little to comment in that area. We moved along to booking online, and we felt there was very limited access on that, and also using the patient online thing, as some felt that was an invasion of privacy, or could be a lack of I think it was lack of privacy there. But Jill and I, through our experience on the personal patient experience line, brought up the fact of the receptionist and the public's dealing with the receptionist, particularly when the receptionist tries to triage the patient. And this has been felt to be the fact that then a lot of them, if any of them, are trained to do triage, and our attitude from the PEP has been that they should do one function only, and that is to actually book the appointment. But it was brought out that the receptionist could actually ask questions to guide the patient to the right clinician or nurse at that point. I think I've said enough. Thank you very much.
On registration, we thought it was fairly easy to register, except for people who were homeless, asylum seekers, and people of that sort, with those sorts of problems. Also, we heard that GPs sometimes removed people who didn't turn up for appointments over a period of time, which seems very odd. How did they check what had happened to these people? More seriously, what happens when you can't register? Is there any information provided by the CCG? For example, leaflets, etc. Is it publicised? A lot of people don't know about the CCG and that they can go there if they can't register. What would they do? Would they walk into one of the hubs, or would they go to A&E? Would that be their only resource? We felt what to do if you can't register should be more widely publicised. Getting appointments. At Healthwatch, we've found by investigations into different surgeries, getting through on the phone is a major problem with long waits. Booking online can be a problem. Booking is a problem once you've got through, with 2 to 3 weeks wait to see any doctor, and very difficult to see your own doctor. We felt receptionists should give more advice. For example, maybe a nurse or 111 could help in an emergency. Timing of appointments. Clearly, people need to be able to get appointments if they're at work, if they've got childcare, if they're a carer, somebody they can't leave, or indeed if it's urgent. How important to see a specific doctor, your own doctor, quite important, but you never manage it. Depends really on what the issue is. If it's getting results back for something quite important, might be serious, then it is. And lastly, records should be kept by all doctors. Just something I'd like to add. It's been referred to briefly by the CCG sort of representatives, but it seems to me that in good practices where booking and telephone is good, one idea will be for practice managers and other staff at those surgeries to be able to see people from surgeries where the service isn't so good. In other words, where services for booking and telephone are not good, then staff from there could go and see what the practice is in surgeries where it is good.
These are what came up in our group. There was various discussions around, everybody has different ideas about how we go about things. We look at some old, which is customer service. Some older people find it difficult to use in technology. So therefore, we got to prefer to speak to someone. Some people like to speak to someone for reassurance than over the phone, holding on and something is playing music or doing something. They're not happy with that. Why can't GP do same day appointments and not wait for 2 weeks? In the group, some people using technology so they are able to have their appointments. So some people are very disadvantaged of getting these type of services. The positive is the electronic prescriptions, appointments. Still feel there are some people with no electronic, so therefore they find it difficult to get. And sometimes when you call in the morning and you're hanging on, the appointment is gone. You have no more left for the day, so therefore you have to wait about a week or two. GPs now recognizing carers' needs, which is really good. So they will look at prioritizing. Some GP surgeries are doing that. The phone line, as I said, extremely busy. Not happy with receptionists when blood tests are being given over the phone. Although you have confidence in some of the receptionists, it's not all the time. You're seeing them when you go into the surgery and you look at them and they know all about you. So therefore, that is also to do with pride. So I think patients should be informed when doctors are behind time. And the other thing, we have things like happy with their GP, so some people are very happy, so you have some positive and some negatives. Thank you.
We touched on a lot of the things that have already been said by the other tables. The receptionist staff, we didn't feel that they gave privacy. We've talked about all the other things that the receptionists do is trying to diagnose, to protect the GP from having appointments. We feel they try and sort of, really find out what's wrong with you. Unless you're on death's door, they don't really give you an appointment. But also, a lot of the times after you've said what's wrong with you, they actually, you go through this big rigmarole and then they say, well, actually you need to see the GP, but you can't see him for another 3 days or something. So that's one of the things. And the main concern was the privacy. We didn't felt the receptionist really gave you the privacy that you needed. And I think a lot of other things we talked about, the other tables mentioned. About triage, we felt that they make assumptions and perhaps give poor advice. Didn't really think they were trained to give you a triage. I don't know what your experiences are, but we felt that the receptionists shouldn't really give you advice on medical appointments, whatever, medical diagnosis. And we felt contact via mail and the phone with the GP is really good. So we would like to have the GP email us, and that felt personal. What else? Referrals, people that have had referrals, we felt that there was lots of miscommunications between the hospitals, doctors, clinics, whatever it is, and that could much more be improved. That's joined up services, which weren't very integrated. Finally, I think referrals, from what people have said, went quite easy, but we did have a lady on our table who's had an absolute nightmare between hospitals and the doctor. She felt that the hospital, because they were looking after her, the GP wasn't really concerned, and not concerned, but didn't take an active role. He just let her feel that she was their responsibility. And yeah, that's it.